the topic of COVID. It's on the mind of everyone these days. First of all, I would like to explain that what I'm going to say is from the perspective of the Buteyko method, but also it's from my own experience as a Buteyko specialist and from the experience of all other specialists. And a big part of also what I'm going to say comes from the knowledge accumulated by medical doctors in the Buteyko clinic in Moscow, and specifically the Russian patent holder of the Buteyko method, Dr. Novozhilov. You will find a lot of information in the COVID bundle we are offering right now, and it really covers all aspects related to the Buteyko method and this virus. And what I'm going to tell you today, it's probably going to be a brief version of what you find in those 3 video courses. And one of them was created by Fred, who worked with COVID patients in a hospital in New York throughout the most difficult times. Well, first I'd like to say that COVID is a respiratory disease, and it could be more dangerous than others. It could be quite new and unfamiliar and scary, but still it's a respiratory disease. And it's proven that, that the Buteyko method is incredibly effective with any respiratory disease and with any flu-like disease. So the data regarding it, including clinical trials, has been collected for more than 50 years now. And it shows that people who practice the Buteyko method don't get infected by viral respiratory diseases. And it happens for 2 reasons. The first one is because people who practice the Buteyko method breathe through the nose 100%. And the nose, as you all know, is the organ which prepares the air for our consumption, and it filters and sanitizes the air. So a lot of harmful microbes and viruses get killed on the mucous membrane of the nose. And that's why people who breathe through the nose are much more protected than people who breathe through the mouth. And the second aspect of it is a high level of carbon dioxide, our vital energy, our prana, which means high immunity, and it's the best possible protection. So I also would like to go through, very briefly, through all stages of COVID and explain how the Buteyko method can help with every stage. So the first one, of course, is the most important, is the prevention. None of us want to get infected, and it kind of makes sense to do everything we can to avoid this dangerous virus. So the best protection against COVID is the level of carbon dioxide in the lungs, which is at the level of the norm. And as many of you know, Dr. Buteyko described this norm as 60 seconds, control pause of 60 seconds, or to be precisely, it's called positive maximum pause of 60 seconds. But the lowest acceptable level of the norm is 40 seconds. So if a person has a morning positive maximum pause of 60 seconds, there is nothing to worry about. And there is no need to go into the discussion what vitamins could help, or what vaccines and all other means, because a person is fully protected. It's kind of the end of the story. So of course, not all of us are at that point. And if you are not, you really need to do everything you can to make your control pose or positive maximum pose as high as possible. There are two ways to do it. One is by doing breathing exercises. The other one is by following a lifestyle supportive of a high level of, I'll call it casually control pose here, of control pose. And it's better to do both. In our video course, the Buteyko map for just a step-by-step program, you will find step-by-step program how to implement it. However, we have an interesting factor here. It's wearing masks. It's kind of a new thing in a way. And many people have questions, you know, whether it's good for us, for our breathing, or bad for us, for our breathing. And how does this situation look from the perspective of the Buteyko method? So in short, it looks very positive actually, because now, you know, I go outside, I go somewhere to a supermarket, for example, and I see everyone wearing a mask, and I'm like, wow, what happened? Everyone is practicing Buteyko now. Times are changing. Yeah, so when we are wearing a mask, we are practicing reduced breathing. And instead of fighting against reduced breathing, which is for most people who don't practice Buteyko, it's like an initial reaction, it's really important to relax into this feeling of a slight air hunger and stay in tune with your breathing there. And in this case, the mask will help you to increase your level of vitality, your level of carbon dioxide, and improve your respiration. So, of course, the first thing while wearing a mask is breathing through the nose instead of the mouth. And if this is accomplished, then try to pay attention to your breathing while wearing a mask. For example, my own experience is that I notice that when I'm wearing a mask and I breathe through my nose, the sound of my breathing becomes much more obvious to me. It's not that obvious without a mask. So I could actually easily evaluate whether I am inhaling quite a lot or very little. And I can easily start manipulating my air intake, reducing it more and more. So it's a wonderful tool. And if it's too difficult for some people to apply it in their life, in a kind of in a normal situation, then I would like to suggest just to use it at home first. Sit down, relax as much as possible. Make sure you are breathing through your nose. Make sure that your breathing is quiet. Put the mask on and use it to reduce your breathing even further. So this is a great exercise which allows us to be mindful of our breathing and to maintain reduced breathing. And of course, if you start doing the same while walking, while doing all kind of chores, it's only a plus. There are no minuses there. And while choosing a mask, just try to choose the one made out of natural materials. That's also important because you don't want to filter the air which you are taking in through the synthetic fabric. So that's prevention. If prevention wasn't successful and you got infected by COVID, then the question is what to do. And according to Dr. Novozhilov, the first day when the infection is recognized, when the symptoms become present, is enormously important. Because by applying the Buteyko method right away and doing it intensely, you can avoid hospitalization, you will be able to avoid acute pneumonia, and you will be able to prevent your lungs from severe damages. So this is kind of clear. We need to do the Buteyko method. We need to apply the Buteyko method right away. But for some people, it's not clear how. And I'd like to say just a little bit about it. There is such a thing as Buteyko retreat. And during the first days of this disease, it's really important to know it. So you might want to start applying any techniques, any Buteyko techniques you know, like gentle breath holds would work very, very well, but it will be very important to apply it throughout the whole day, whether formally or informally or both. But what's usually recommended in critical situations is to spend the whole day doing breath holds combined with relaxation every half an hour or every 15 minutes of every hour. That will allow you to increase your control pose significantly and keep it on the highest possible level, which will accelerate your recovery and most likely will prevent any kind of severe situation. Normally, people who practice Buteyko, even if they get infected because their control pose is not high enough, if they start applying the Buteyko techniques right away, they recover within a few days without any problems. So then the next step, if those few days were not used effectively and a person end up with severe breathing difficulties, so with kind of severe symptoms, and he or she became hospitalized, then there is the next question, what to do in this situation? And I'm sure Fred will tell us more about it. Fred is the expert on this issue, and in his video course, also he talks in great details about what to do. But here I just want to say that if you are in hospital, then your main goal from the perspective of this method is to avoid being placed on mechanical ventilation. Because according to Dr. Novozhilov and other Buteyko doctors, in most cases, this creates a high level of hyperventilation and often becomes a cause of death. So according to Dr. Novozhilov, I'm sorry, this is not according to him, this is just statistics that 87% of people placed on mechanical ventilation die. So 1 of 2 people out of 10 survive. It's a very, very small percentage of people who survive. And according to Dr. Novozhilov, they die not because of the virus, but because of a high level of hyperventilation, which they experience being placed on mechanical ventilation. So I know that if I would be in a hospital, my goal number 1 will be to avoid it, right? But in order to avoid mechanical ventilation, you need to avoid really strong symptoms. Because if you have them, if you have pneumonia developing incredibly fast, you will be placed on mechanical ventilation. And I don't think that you have a choice in this situation. So it's very important to use your time as effectively as possible. And there are plenty of mild breathing exercises which could be very, very effective. And it's easy to do them in a hospital. One of them is humming. For example, when you're in bed, you could do this like, and continue doing it for as long as possible, of course, within the frame of what your respiration allows you. Also, most of you know that movements, just mild movements, combined with quiet nasal breathing, effectively increase the level of carbon dioxide. So it's possible to do that as well. On our website, I have a video, and on YouTube, I have a video where I show where I showed a breathing exercise I call Super Healer. And I believe Fred also demonstrated it in his video course. So it doesn't require a lot of movements, very small, mild, kind of gentle movements, but it helps tremendously. So this can be done in a hospital as well. And then kind of the last stage, if nothing was done correctly or nothing helped, I want to correct this statement. The Buteyko method always helps. It only depends if a person applies it correctly and consistently, but assuming that it's applied correctly, it would work. There is no other scenario. But if it wasn't applied, and let's say a person was placed on mechanical ventilation with severe symptoms, and he or she survived, however, he ended up with his lungs being damaged. Then the question is what to do then. The Buteyko method helps to restore the function of the lungs in the areas which are still alive, which can be restored. And Dr. Novozhilov always says that just a half of one lung is enough in order to have regular life. So a person could live for a long time and be totally functional, even with a half of one lung. But in this case, we need to make sure that whatever is left works very well, works effectively. So in this case, a person could be trapped in a very difficult situation when he or she thinks, well, before I was able to walk 5 miles and I was totally fine. And now I just walk for 100 feet and I feel totally out of breath and I feel fatigued. I don't know what to do. Shall I push myself to walk more? Or shall I just relax and stop walking? And this is a very difficult situation because if a person decides not to exercise, his or her level of carbon dioxide would go down, and that will worsen his overall health and, of course, the respiratory function. And if a person decides, no, I'm going to push myself to walk or to exercise as much as I used to, it will be the same effect. It will be worsening this person's health. So at this point, it's become incredibly important to find what can you do within the frame of what your breathing allows you, and do only that, gradually building up your strength. And of course, for some people, it's very difficult to find this balance by themselves. And for people whose lungs were seriously damaged, I strongly recommend to work one-on-one with a specialist to make sure that their recovery path is successful. And probably the last thing I'd like to say is about anxiety. Anxiety automatically means hyperventilation, overbreathing. There is no anxiety without overbreathing. Anxiety means fast breathing, shallow breathing, chest breathing. And this breathing makes a person vulnerable for COVID. It kind of opens the doors for COVID. So at this time, it's incredibly important to control our thoughts as well as our breathing, and not to allow ourselves to go into that panic mode. What happens if I get infected? What happens if my child or my husband, my wife get infected? So it's very important to stay with positive, with positive thoughts, with positive visualizations, and keep breathing like everything is fine, that your life is completely perfect. And also your life is completely stable. You are totally protected from all kinds of trouble. And speaking about mind control as well as breath control, I need to mention that in this case, if you have a solid spiritual tradition, a solid spiritual path you're following, you are incredibly fortunate. The Buteyko method is not just a collection of different breathing techniques. Spirituality plays a huge part within the Buteyko method. The Buteyko method doesn't exist without spirituality. And usually when a person follows or applies authentic spiritual techniques, his or her control pose goes up. That's the normal effect of spiritual techniques and rituals. So please remember it and try to stay as positive as you can, and try to keep your mind as well as your breathing at the state that everything is fine right now, everything is okay, even when it's not at all. And our breathing, as you know, as you already probably know, our breathing is contagious. So if we breathe in an anxious way, we make people around us breathe the same way. And if we breathe in a peaceful way, we actually make breathing patterns of people around us more peaceful as well. So in a way, it's our responsibility how we breathe, because it impacts our contribution into the world, into the society. So slow, nasal, quiet, relaxed breathing will help you, will protect you from COVID, and also will help everyone around you. I think I'm done with my talk. Thank you. And I don't know if probably we'll switch to Fred now, and then both Fred and I will answer questions if you have questions. So as I said, if you'd like to just share something, it's also totally fine, and please do that. Okay, I'm giving the microphone to Fred now. Oops, no, Fred, you need to unmute yourself.
Yeah, Sasha, I have a question. Can you hear me?
Yes, I'm not sure who's talking.
I'm Ari.
Just a second, let me find you. Ari, okay. Yes. Yes?
Yes. One thing that I'm not sure of is how to determine between the control pause and the maximum pause. I'm not sure how to determine between the psychological feeling, well, I'm holding my breath, and whatever key would give me the information to, okay, now I've reached that point where I need to, where I should be breathing. Does this make sense to you?
Yes, it makes total sense, and people often have this problem. So I'll just for a minute, I'll show you this page of our website. It's called Breathing Test. And you will find videos here with a detailed explanation on how to measure control pause and positive maximum pause. So that might help you, but in general, often at the beginning, even when people know how to measure the control pause and positive maximum pause, it's still difficult for them to determine exactly what they're measuring. And it's totally normal. It's not a problem actually, because at the beginning of the process, all you need is a reference point. Dr. Buteyko measured everything in positive maximum poses, but he created control pose for beginners because it's easier for them to measure their breathing this way. So if you're having a problem to decide where the end of positive maximum pose, then just stay with control pose, which is a more gentle way to measure your breathing. And even if you are not measuring it correctly, it's fine for as long as you measure it gently and the same way all the time. Because at the beginning, all you need to know is whether your control pause is increasing or not. And when it will be high, your sensitivity to your breathing will also increase, and then it will be easy for you to switch to positive maximum pause, but also to understand the difference between control pause and positive maximum pause. Does it make sense?
Yes. Yeah. What I was saying is that to me, it seems like a lot of times being able to distinguish between the psychological thought of, well, I'm holding my breath, but I'm really not feeling any physical distress. but nevertheless, because I'm holding my breath, I'm feeling some psychological discomfort. So distinguishing between that psychological discomfort and any physiological discomfort, and I guess I just need to work on it some more.
I believe so. I believe so. And it doesn't matter whether it's physical discomfort or psychological discomfort, whether one or another, but it shows you your current limit, right?
Uh-huh. So would you say then that once a person starts having these thoughts, I'm holding my breath, I should be breathing freely, that's the end of the control pulse? Is that what you're saying?
Yes, control pause shows us the time you are comfortable.
Uh-huh.
So when you're not comfortable, whether psychologically or physically, that's definitely the end of the control pause.
Okay.
Level.
Okay.
Thank you.
Thank you.
Fred.
Yes. Hello, everyone. Can you hear me fine? Yes. So since the topic was on COVID, I'd just like to bring to, the forum just my perspective and my experience from related to the hospital, and some of the experience that I gained through this period with being a Buteyko specialist and dealing with a population where I had to, on a daily basis, manage and assist actively positive COVID patients. One of the things that I saw transition throughout this time period amongst even healthcare workers is their level of anxiety. At the very beginning, people didn't have a whole lot of knowledge about this disease, but then when there was a lot of information being broadcast on the news, that's really when I saw a transition in people's kind of approach and fear and anxiety and their whole concern about, PPE, which is titled, abbreviated for personal protection equipment. That became a very big topic and a great concern, which is understandable. But as a Buteyko specialist, I felt that I was privileged and in a unique position to be able to not have to experience that same level of fear and concern. Because as even Tasha has shared, one of the most important things when it comes to respiratory diseases, one is prevention. And if you have an active problem, having an effective method of recovery, which Buteyko breathing method provided that information for me. And so I was able to engage with patients without any concern, without any fear, because one, I already had the knowledge and have been practicing Buteyko, and my control pause was in the 40 to 60 range. And so that gave me a great deal of comfort, which I think is key, because you never know when you're going to have to experience a virus or, an illness. But if you have a level, engaging in the practice that provides you prevention, or in another case, improving and maximizing your immune system, any exposure to any virus or issue or health issue, your body will respond to it differently. So it gave me a great deal of comfort. But I saw amongst my colleagues, everyone was really, going out of their mind in many sense, very anxious, So with my patients, those are one of the things that I kind of focused on, trying to help them, one, focus on relaxation, recovery. And I saw that for those who weren't in a critical situation, to have a tremendous amount of benefit. I think of one gentleman that was COVID positive, and at the beginning of my shift, I approached him. I saw he was kind of breathing fairly heavy, and he was on a certain level of oxygen. And that was one of the things, in addition, that I try to bring to the table now is, some basic Buteyko principles along with my therapy. And I told him, focus on nasal breathing, focus on relaxation. These are the things that, tools that I give my patients now. And I find that consistently, they're tremendously grateful, because outside of that experience, patients are usually not given any instruction when it comes to what to do in relation to their breathing, even though their main problem is a breathing issue. So I find consistently when I'm working with patients and I'm on shift, they're extremely grateful, because you can't give something that you don't have. And even as a respiratory therapist, believe it or not, we're given fairly little instruction as to what to share with a patient to help them with their breathing from a exercise approach. It wasn't until I got trained and came across the Buteyko breathing method that I really felt empowered to really be able to be a true therapist. Because outside that, the focus is really on medication. If a person has breathing issues, okay, give them albuterol. Oh, they need a treatment. They need oxygen. And that's pretty much from the health standpoint of the tools that we're given to address issues. Between oxygen, they need a breathing treatment, or some other type of machinery, hospital machine, to help assist oxygenation, and then intubation. That's pretty much the tools that we're given as, breathing specialists. But going back to this gentleman, before that shift was over, because he changed his breathing, because he listened, and these are simple things that, it's not complicated. See, that's the other thing that I like about the Buteyko method, is that they're simple, but that's what makes them powerfully effective. Because when things are simple, then the average person can apply it. When instruction is too complex, then it's difficult for that average person to apply it. And so this is what I'm finding in the hospital. This gentleman, he was able to apply it, and before the shift was over, he was off his oxygen, on room air, and less anxious and more comfortable than he was when I first started on the shift. So these are the things that I've also found to be fortunate to have these experiences, because many others outside of the hospital don't have these experiences. And so it's given me a great sense of confidence and assurance when applying it to even the sickest patients. They still work. So if they work with the sickest, how much more for the average person? And on that level, I've seen the same working with clients through our Buteyko breathing sessions. I've seen the same results from week to week. People have significant shifts in their breathing issues, and as it was mentioned today, their anxiety issues. It's almost like another key component that oftentimes is missed initially, is that when you're in the hospital, just being in the hospital creates a level of anxiety, because oftentimes a lot of your rights are stripped from you. You have very little decisions, and that too, I've found it to be significantly helpful for patients to help them to decrease their anxiety. Because as it was shared, which I, wholeheartedly agree with, and that is anxiety promotes hyperventilation, and hyperventilation promotes anxiety. So that's a vicious cycle that I try to focus on with my clients when it comes to, especially in the hospital and when they have health issues, that within itself creates anxiety. So these are the things that, from Buteyko's perspective in the hospital, I found it to be really important. Going back for myself, there's been a great deal of media coverage with PPE, personal protection equipment. Well, I kind of find that I focus more on not the PPE, but I focus more on the PPG, and that's your personal protection guru. And what is that from the Buteyko perspective? Our nose. I think that, once again, is another valuable understanding that as Buteyko, people who practice Buteyko and know about Buteyko give us a tremendous advantage over the general population. Because most people, they're not concerned about your nose, which is your most important protection. It's not the mask, it's your nose, breathing through your nose, And even if, as Sasha had mentioned, even when you're wearing a mask, you still need to be focused on, it doesn't trump your nose, you still need to be focused on nasal breathing. So these are the things that I try to bring to the table and bring the right focus in line, because unfortunately, because of news, because of media, because of people having a lack of frame of reference to really what is truly healthy, and not having the information that we all have, they have no resources. So this is why, I see that they're just grabbing at straws and putting their entire confidence in things that lack true value. Putting their entire confidence in, okay, a mask or a vaccine or what have you, which we all know, when everything is said and done, it's not going to make things better. It's going to make things, if not worse, especially if they're not addressing the most important foundation when it comes to our health, which I find in this forum, we have a tremendous advantage. And so that's what I'd like to share with everyone, remind everyone that you're at a good place. And, the things that you're experiencing, I see on a whole nother level, and it's just as effective. Even, I talk in the session, in the video session, on even my experience with applying Buteyko with ventilated patients. I'm not telling the person to manipulate their breathing, because once you're on a ventilator, you're out. You have no control. You're on medication and you are pretty much unconscious. But applying the Buteyko principles with the ventilator, I've seen a tremendous impact and improvement. Whereas in the beginning of the shift, they're on a ventilator, not expected to come off. By the end of the shift, that person has made progress and we're able to get them extubated. I've seen that firsthand. So it works on every level, whether it's the healthiest to mildly sick to the sickest, just in the same as it works with prevention, as Sasha had mentioned. With recovery, can it quicken your recovery, or improve your restoration if you've had damage. And so on all levels, no matter where you are, it can have some impact. So hopefully that is helpful to everyone.